To, to wrap up with a couple of slides about some of the things that are out there and are happening, the healthcare reform bill has provided for funding for several what I feel fairly innovative programs. Accountable care organizations, medical homes, telehealth reimbursement has been around for a while but expands telehealth reimbursement. Accountable care organizations, as opposed to fee-for-service, are vertically integrated organizations of care where there's a group of primary care physicians, specialists, and hospitals that all get together and say, we're going to be accountable for this patient's health. Okay? And those are growing. They're trials right now, and there are strict Medicare guidelines or CMS guidelines that apply to the accountable care organizations. Medical homes, on the other hand, differ a little bit from accountable care from the standpoint that there is one personal physician that is responsible for a patient's overall health. The nice thing about these approaches is it's a much more holistic approach to the overall health, and a patient and the amount of money that's being spent on that patient is much better coordinated. So it's a much more efficient system. And it's a better care delivery system because it's more integrated. You've got one group or one physician that knows everything that's going on with that patient and is responsible for that patient. So as we move, and I think this is inevitable because we just flat out don't have the money in this country to continue with a fee-for-service program. There's got to be some innovation like these kinds of things. As we move from fee-for-service to overall accountability for health and reimbursement and bonusing based on that, there's going to be a much more efficient use of resources. So, key lessons learned. And again, this is coming from my personal experience, but you know, I've been through the wars. We've been successful. We do a lot of work internationally, like I said at the beginning of my presentation, and I think honestly our organization would not be around if we had just come into the U.S. and just stuck to the U.S. and tried to make a living at it. Socialized medicine in the UK, socialized medicine or a combination of it in Australia, Hong Kong, others that were operating, United Arab Emirates, the European Union, make it much easier for us to be reimbursed. It's a much less complex and tug-of-war type of a system. So if it's not lowering costs than existing treatments, forget it. And I'm not talking about sheer cost numbers, I'm talking about value. You have to sell the value of what you're doing to every, all the players, the beneficiaries, the patients, the regulators, the payers, the providers. Plan for an extra year of regulatory. Our FDA 510K, even for a device that had many, many predicates on the market, took us 9 months to get our 510K, and we thought that was record time. Plan to give the product away for a year because you're trying to seed the market. Okay? You're trying to get people to use it. You're trying to get physicians to use it. Plan to do a lot of pilots. Plan to fund clinical trials or to find someone that will fund clinical trials. It's evidence-based medicine. It's the value proposition that's behind what you're doing. Even if you're the same price, they're sort of like, well, I don't want to change from the meter that I'm using today to use your wireless meter. Do you have any studies that show that? That show that this is an efficacious way to go, and overall it's going to save me money. We've spent a lot of time doing that. Be prepared for a new language and a lot of paperwork. HCPCS codes, CPT codes, it just goes on and on. It is a huge barrier to entry, but once you understand how to get through that and how to get reimbursed, it's good. It's like I say, it still doesn't happen automatically, but you can work your way through it. Work with large players with name recognition and contracts. I mentioned McKesson. McKesson is our main distributor in the U.S. They've got 200 payer contracts, but just by the fact that we're working with McKesson, we're automatically able to be reimbursed by all 200 of those payers. So that's really helped us a lot. encourage patients and providers to drive it. We're working with the Blue Cross Blue Shield folks in Hawaii. There's one physician there that loves this product, and it's Hawaii, as you probably know, is a very close-knit community. And he has pushed it out, and we're getting really good traction in Hawaii, just as a geography, just because we've got a provider that really wants this and drives it. And now the patients are picking up on it. The payers are coming back around. I even got a call from CVS Caremark, which I couldn't believe. And be ready for downward price pressure. We all know we're all in this business ultimately to provide for better health for people, but we also have to do it more efficiently. So, in conclusion, patient access to innovative technologies like wireless health are directly and indirectly limited by the current reimbursement system. Okay, focus on your product's value proposition. I really think that we're in a perfect storm for this all to work for us. Demographic, political, regulatory, economic pressures will ultimately lead to sustainability for wireless health products. I truly believe that, and I think along the way we're going to do a lot of good things to benefit the patients. Thanks.